Welcome to Donna Roach. Thank you so much. Yes, I do have a farm and I do have a land. So, but yes, I did work more than one job at a time because being a paramedic pays nothing. You had to pay the bill somewhere. I am the executive director at Lakeside, and I do have a lady that sits in my office all the time. She is wonderful. She is 89 years old. And for some reason, she just started coming and sitting in my office almost every day, all day. And so whenever I would have a tour, they would come into my office and she'd be sitting there with them and helping me tell about Parkside. And so I just started doing. I said, this is my sidekick, this is my assistant. And she would tell them, the pay is lousy. She said the food is good, but the pay is lousy. So I guess I need to give her a raise. But yes, I was a paramedic for 30 years on the ambulance up until 2022, as well as working all those other jobs. And I will tell you, I started out because my grandmother fell in 1990. She fell and broke her hip. She tripped over the phone cord back when there were actually phones, and she tripped over the phone cord. So my parents lived next door to her. So she called my mom. My mom then calls me, calls my aunt, calls everybody. We all go running over, waiting on the ambulance to come. And when they get there, I noticed they have volunteer ambulance service on their back, Olive Branch volunteer ambulance. So the next day I see this group come in, they grab them all up and off they go. So I called and I said, how can I be a volunteer? And 30 years later, I was still in the ambulance, but I'm getting paid. We were volunteers there I was working as a volunteer on the ambulance for 2 years, went to EMT school and then went to paramedic school. And that was back in 1990. So I tell you that to show you the difference. When Mama fell, she broke her hip. The next day she had hip surgery, had a hip replacement, and stayed in hospital about 4 or 5 days and came home. Now, if you fall and have a hip replacement at that age, you normally go to an inpatient rehab or somewhere like that because Medicare pays for it. So that's the difference. In 1990, you go home and hope you get better, whereas now you go somewhere. But a lot of times that is the reason that people do choose senior living. So just kind of get started on there's different kinds of senior living that we have. There's different levels, and a lot of people don't understand the different levels. There's independent living, there's assisted living, memory care, skilled living. There's all kinds of levels that you can choose. So you need to make sure you're doing the right level of care. The people in my building, they don't need a nursing home. They don't even qualify for nursing homes, and you don't realize you have to qualify for a nursing home, but you do. So they don't need that. Somebody in my building would not be able to go to an independent living facility because they do need some care. They do need some things going on. So if you have someone who's totally independent, they can take care of themselves, they still drive, they still cook, whatever, they may choose an independent living facility rather than an assisted living, because if you choose independent living, you're basically going into an apartment complex. You've just got a community with that, where they do have a dining room, where they do have activities. They have things that you can do with that group. So if you choose independent living, those are folks that are still able to work for themselves. They're still able to get up, get themselves dressed. They don't need a sitter, like Mary Lou was talking about. We do have folks in our building that have sitters. So they don't need that. They can take care of themselves. They drive themselves wherever they want to go. We have a building, my building in Bartlett, and then we also have one in Collier. They actually have a gentleman there who is still leaving to go to work every day. He just did not want to live by himself in his home. And that is why a lot of people move into either independent living or assisted living. They don't want to live by themselves anymore. They don't want the house. They don't want the upkeep of a house. They don't want the yard. They don't want to mow the yard, take care of the yard, or pay someone to do it. And they still want to be able to have neighbors. So if you're in an independent living facility, you have your own kitchen, you still cook, but they do have a dining room, and they do have activities. They have trips and things that they go to. So if you choose assisted living, if you choose that, now that's going to be a little different. And that's someone who they're pretty active. They're still kind of active, but they might need help getting up in the morning. Once they get up and moving, and I don't know about y'all, but there's some days I just don't want to get up and move. You know, I wish I had somebody come in and help me get up. So they can get up and do on their own, but they might need to have somebody come in and help them get up and just get that first round of moving, maybe get to the bathroom, maybe get dressed. But once they're up and going like that, then they'll come out for breakfast. So like at our facility, we have resident assistants, and they go in and they know which residents need that extra help. So they'll go in and help them get up and start moving around. Then they'll come to the dining room. So assisted living, we cook all their meals. They don't even have a way to cook in their room other than a microwave, which can still be dangerous, believe me. They don't have a way to cook. They have a kitchenette, but they don't have any ovens or anything like that. That's the point. We cook their meals. State does not even allow them to have anything other than a coffee pot that cuts off and an iron. They can iron their clothes, but it has to be an iron itself that cuts itself off. So they're very, very strict on what we can allow in there. So they don't even have a way to cook. So they come to the dining room, eat all their meals, and they also have activities. You know, we do their laundry. I'll tell you, I do tours, and I'm thinking to myself, why do I not live here? we do your laundry twice a week. We clean your apartment once a week. We take you wherever you want to go. We fix all your meals. We have activities. And you have all these people that you can, you know, develop as neighbors and friends, and they do that, and they go visit each other in their apartments. I go home, I do the cooking, I do the washing, I do the, you know, I take care of my husband and I both, we take care of the animals, all this stuff. Why do I not live in my own building? You know, but it is nice when you are. I've got the age range in mind is, I've got a lady that's 57. She's had multiple strokes, so she's with us. And I have a lady that's 104. Wow. So good genes. So, you know, you've got these folks that have such an age range, but we are such a family. And I love that. I see these folks, they're at the table, have their table mates, and they're eating together and they're chatting and they're having such a good time. And then you've got the activities and they're playing all these games together. So it's a camaraderie. So instead of having someone live at home by themselves, then you've got a community, and it's a community that comes together. Believe me, they'll come to me and go, you know, the lady that sits at the table over there beside me, she's not eating right. She sits over there behind me. I didn't see her eat in the last couple of days. She picks at her food. She doesn't eat. Or if you're not out and about, believe me, they're going to, where's she at? I haven't seen her. Or has he come? Has he left? What's going on? They take care of each other. They check on each other. And that's very, very nice. So that's the good thing about even in independent living, in a community like that, you've got that camaraderie. You've got somebody that can also make you feel important and make you feel loved above and beyond the staff and even families, because it's difficult for families to get back in and visit. You know, they're working or whatever. And we have several that the families don't even live around here. Some of them live 2 or 3 states away. So it's very important to have that relationship that they get once they move in. So if you are in an assisted living facility, one thing you need to think of is if you have someone that you're thinking about putting in a facility, state requirements for an assisted living is you have to be able to get up out of the chair or off of your bed and onto your device. If it's a rollator, if it's a wheelchair or a cane, you have to be able to move yourself independently. You don't need someone to come in there to help you do that in case of a fire. So that's the state requirement. We do have some folks, if they come to us and they go, well, they had a stroke and, you know, we've got home health that comes in, or we have a sitter that's there and they have to get them up every day and they really can't do things on their own. They would not qualify for us because they can't get up on their own. And that is truly a state requirement. So that's really about the only thing that would keep you from coming to us. Now they do mandate what kind of levels of care. So if you have an advanced level of care, we can, like IVs or things like that, we can't do that. Assisted living, we can take care of colostomy bags. We can take care of wounds to a certain point, but then you have to move on to a different level once you've gone past that. So if you need memory care, we have folks in our building that have dementia, and some have advanced dementia, which I guess goes into Alzheimer's. If you have dementia or Alzheimer's and you're directable, you're someone that we know you're not going to wander out of our building, you can stay with us. I have 4 or 5 now that I've seen them progress to a little more dementia, but they're not wandering out of the building. So they're not a danger to themselves or to anyone else. And I say, you'd think they would not be, but I have had a few of them that they would grab another resident, you know, because they were angry about something. They thought you did something to them. So we do have to watch for that. But those are signs that hopefully the director of the facility would have a conversation with the family as they go along. I don't want to leave, I don't want to lose anybody, but I don't want anybody to be unsafe either. So I do talk to the families and say, you know, we're noticing a little more confusion, a little more, you're not really able to understand, you can't go out that door. I had a lady the other day, she just knew her husband was out there waiting on her. He passed away 25 years ago, but she was sure he was out there waiting on her and she was going out there to see him. But I was able to say, no, he's not out there. But if he does come, he won't want you in your room because that's where he knows to find you. Okie doke, off she goes. You know, she goes to her room. So those are people that are directable, and that's okay because she does not wander out the door. Those are folks that we got wander guards on them that, you know, set an alarm off, but those are folks that they're still directable and they don't really need a memory care. Because what a memory care is going to offer is they do give them some more medications than we would give in our facility that keeps them a little less active, but they also have a lockup. They cannot come out the door. However, be very careful if you're choosing a memory care that you know about the lockup, because I did have a lady, bless her sweetheart. She only stayed with us 2 weeks. Her Alzheimer's just accelerated unbelievably, but she had surgery, and anesthesia does increase Alzheimer's and dementia. So you got to be very careful with that. But we had to send her to a memory care. And when I was talking to the lady from the memory care, she said that they have a sign that says, hold the bar down for 15 seconds to get out. She stands there and counts. So yes, she has Alzheimer's, and with us, she wasn't even knowing her husband when he would come in the door. When she was with us, she didn't even know her husband. I know him in the picture, but I don't know who you are when you walk in the door, kind of thing. And she was packing every day. Every day she packed all of her clothes in a trash bag every day, so we had to take them back out. And she was also, I got a phone call from her husband one night. She's out at the car. There was no car of theirs, but she had a key and she was at somebody's car trying to open it. So I go flying up to the building, you know, to the office, and of course the nurse is out there and already got her. But that's why she had to go ahead and move. But they told me at the memory care last week, she stands there and counts. So they have to watch her even now. Even with Alzheimer's, they can still understand.
Yeah, Donna, on a happier note, what day of the week is sip day for beer, margaritas?
Actually, they do have some sort of activities with alcohol in them. During Mardi Gras, they did.
Yeah, my mom, when she was at a facility like that, used to spike the lemonade.
Oh gosh, that's too funny. That's funny. She'd go around everybody's cup.
See where he gets his personality.
But yeah, they do have that. They do have days where they have mixed drinks, but there are some facilities, and that's another thing. If you have a problem with that, there are some that they have happy hour every day. And I'm thinking, oh yes, let's encourage that fall. So yeah, so you know, you've got an independent person who can still live in an apartment complex and do what they need to do, and then you also have assisted living where they need a little bit more care. You don't want them cooking, you don't want them, I mean, I would not want my 104-year-old cooking in an apartment complex. And then the memory care where they get pretty much, they can get up and do things on their own. The lady that I was talking about, she got herself up and dressed every day. Gave herself a shower. She still does. But once she tried to remember things and things were not clicking in her head. So they're still independent even with that, but they just need that extra care of memory care. So the other thing is if they need skilled nursing. Now that's a nursing home. And people be aware, if you're trying to get your mom and dad in a facility, this is what pops in their head. Because what did they grow up with? Oh, we got to put grandma in the home. You know, that's what they grew up with. So there are different things, different levels of things. Understand a skilled facility, that is a nursing home. But those are for people that truly need advanced care. Some of them have IVs going all the time. Some of them have feeding tubes going all the time. We can't do what they call peg tube. I don't know if y'all know the difference with the peg tube or the NG tube in their nose. We can't do either one of those in our facility. So those are folks that have to go somewhere else, or they become bed confined. Now, if you're on hospice, yes, you can stay in our facility because you will have a sitter with you. Even though you're aware you can no longer get yourself up and moving, you will have a sitter. So you can stay for hospice. We have 3 on hospice right now. So you can stay because they want to stay where they've been. I've got folks that have been there since it opened. They want to stay there till the day they die. Bless their little hearts. I'm proud to have them there. We love them. We don't want them to leave. So if you're going to a skilled facility, be aware that is for the advanced care that you can't get anywhere else. And the thing you need to think about with that is talk to people and find out what they know about a facility you're thinking about. If you've got a loved one in the hospital and they tell you mama or daddy's got to go to a nursing home, that's not always the case. I have to fight to get my folks back. And once they go to the hospital tries to send everybody to a nursing home. And I'll call that social worker and say, no, ma'am, if I have to come and get them in my car, they're coming back because they don't need a nursing home. They're able to get up, they're able to talk. I've got one guy, I talked to him on the phone. They sent him to a nursing home, but he still needed an IV. So I'm trying to keep up with him, make sure he gets to come back. So if you've got the hospital telling you that you need to go to a nursing home, investigate that. Find out why, especially if they came from a facility. So find out why, because not everybody needs one. But what you need to know is if you've got, like my grandmother, she didn't go to a rehab facility. There are inpatient rehabs. You can send that person to an inpatient rehab, not a nursing home, for short-term physical therapy. I've got some right now that are in Encompass, which is great. They are a great hospital. They're in there for short-term physical therapy. They've been in there for about 2 weeks. Medicare pays for 20 days. Most places like to use up for 20 days. So they're there for 2 weeks right now. They're getting short-term physical therapy, and then they'll come to us where we have physical therapy in our building. So don't let them send them to a nursing home just for physical therapy, because there are other options. Because once they get in that nursing home, believe me, I've seen it happen. I had 3 right after I started at Heartside. They declined so badly in the nursing home. Number 1, they thought everybody had given up on them. Number 2, the care was not great. And number 3, they just went into depression. So be very, very aware of where they're going. If they can, if they're just going for physical therapy, send them to an inpatient rehab. That's going to be the better bet. Okay, so you're looking for a facility. You need to think about things to ask. And I am one to, if you come to my facility and you tour with me, I'm going to tell you, look other places. You should be looking at all of them in the area. Compare, compare, compare. I want you to compare. Because if you're coming to me, I want you to know this is where you want your loved one to be. But you need to think about certain things. Some of the things you need to think about are who's going to pay for it. Who pays for what? Independent living and assisted living is on your dime, unless you've got long-term care. Long-term care will pay for assisted living, and some of them will pay for some things in a nursing home. But if you're an independent, it's your pay. If you are assisted living and you don't have long-term care, it's on you. You have to pay. So you need to be able to know what you're getting for your money. What kind of amenities? Are there meals included, transportation, laundry, housekeeping, assistance with daily living skills like we have, and medications? Some places are classified as enhanced living. You think it's assisted living, but it's not. You need to ask, is there a nurse here who's going to bring my mom or dad their medicines? If there is, that's great. Some of them say no, but we can watch them take the medicines. Yeah. Huh? Okay. So you need to understand who's going to pay for what. Are there pets allowed? Because that's a big thing. They can take their pets with them. Food, meals are very important. Ask if you can come eat lunch. I always offer, come eat lunch with us. Bring mom or dad. I put them at a table with folks that will chat with them and come and eat lunch. Or if you have a bunch of family that wants to come, I'll put you in the private dining room with a couple of the residents. So always check out the food. That is a huge, huge thing. Speak to the residents that are in the hallways, because if you don't, you might forget something. But speak to the residents in the hallways. If you don't see residents in the hallways, ask why. Where is everybody? Now, if you come to my place on a Saturday or Sunday, they're probably all in the bed after lunch. They're gonna take that nap because music starts at 2. So they're gonna take that nap. So just know who pays. Now, independent living can start anywhere from 1,500 and go up from there. Assisted living is usually starting around 4,000. If it's under 4,000, ask about level of care fees, because there are level of care fees. $200 a month extra for the nurse to bring you your meds. $200 a month extra for a resident assistant to come in and help your mom or dad get up every day. $200 extra for transportation. So that $200, $200 can continue to go up and up and up. The other thing you need to think about is how much is the rent going to go up every year? We have been very, very blessed. We had 5% increases that went up to 8 this year. Some of the ones in the city that, because I'm in a competitive marketing group, some of them went up 21%. Yeah. Yeah. So ask how much you think it's going to go up, because you really need to know. Memory care can start at $10,000 a month and go up from there. So just again, it depends. And if there's 2 people, you got mom and dad, ask about a second person fee. Because for us, we have a second person fee. For memory care, they count it as a second person. So if you're paying $6,000 for mom, you're paying $6,000 for dad. Very, very important to know. If you have long-term care, they will pay for part of it. If you're paying $150 a day for my facility, and your long-term care pays $165 a day, that's great, because you have some leeway to go up if the rent goes up. But remember this, they only pay for the days that you're in the facility. So mom goes to the hospital on the 1st of the month. She doesn't come back till the 16th of the month. Those 16 days are your responsibility, because long-term care won't pay. They only pay for when they're there getting that care. And they also have to meet 2 to 3 levels of assisted living care. We do showers. Even if I don't have to help you take a shower, we do standby. So we mark that as a standby. Cook your meals, because you're not cooking in your room. Had a guy that put something in his microwave, supposed to be for 30 seconds. He put it on 3 minutes and went to sleep. He literally scorched the cabinets. I get a phone call from the alarm company, smoke showing. What do you think that does to me in the middle of the night? So they don't cook. So that counts as 1. And then helping them, you know, get dressed or whatever. Those, we can usually find 2 to 3 things. So those are the things you need to think about as well. And she was saying it's a traumatic experience. It is a traumatic experience. You need to help them understand this isn't getting rid of you. You're not going to a nursing home if you're in independent or assisted living. We are going to take your furniture. We're going to take your mementos. Oh my gosh, they bring them. We have a walk-in closet, and I've never seen so many clothes in my life. They do bring them. And one of the things you can do is help them understand, let's go measure the room so we know what fits where, so they can choose the things that they want. Bring them with you. I have had so many people that come in, they move mom's stuff in, and then tomorrow they bring mom, she has no idea. She has absolutely no idea. That is not fair. That is not fair. So there's so many things that you can do to help make the transition good, and that's getting them involved. They have to be involved. They need to be involved. So ask questions. When you go on a tour, ask a question. Ask any question you want. There's nothing you can ask me that I would not want to answer for you. Also do comparisons. Visit me, visit Harbor Chase, visit Applingwood, Shelby Gardens Place, visit America House, visit wherever. But compare. You know, wherever you want to go, just make your comparisons and make them good comparisons. And even if you don't choose me, I still tell you, call me back and let me help. You know, if you have a question about a nursing home, call me and let me help you, because I can tell you where the good ones are. 30 years on the ambulance, I've been in most of them, and then calling on them in St. Francis, I can tell you the good ones and the bad ones. Unfortunately, we have some bad ones. So just give me a shout, give me a call.
All right, man, that was good. Let me stop sharing. Can you, Taylor, where's this? Let me stop sharing here. Very good, Donna. Okay, so now we're going to move into the next phase of what we do at Talk Shop for about 20 or 30 minutes. And guess what that is?
Bam, bam, bam.
Bam, bam. Do y'all know what bam, bam stands for?
Book a meeting from a meeting.
Book a meeting from a meeting. And guys, for our sponsors, a couple of months ago, we did how to mine gold from your top 25 referring partners. And if you, there's a way to do it, you know, where you have certain phases of following up with them. And I was doing it last night until like 1 a.m, but I was having fun. And it was
text at 1:30.
Yeah,
Oh, you
I
got-
got one at 12:45.
Oh, I'm sorry. I was writing letters, but anyway, the old fashioned way. All right, so we're gonna break into groups for you guys online. Nita, if you and Janice and Amanda want to get together, I can put you in a breakout room so you can do some bam bamming. And for you in the room, just anywhere you want to go over here and here out in the hall, or if you want to go over to Bogies or wherever you want to go. But I encourage you.
No,
from a
I've
meeting.
got to go, but I appreciate it. Y'all have a wonderful week.
Okay, great, Nita. All right, well, Janice, I'll send you the chat log so you can set up a one-on-one with some people here in the room later.
Joe, see if Anita's staying on. The two of them may want to talk.
Nita, you said you were leaving, right?
Oh, she is leaving. Okay.
Oh, that was Amanda.
That was
I
Amanda.
Oh,
think that
Nita,
was
are you
Amanda.
staying?
I
Okay,
can
so
stay for a minute.
Janice, Taylor, if you can put them in a breakout room, that would be awesome. And stop recording, please. I forgot to stop recording. Okay, we'll see you guys next week.
Thank you.